Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. I am joined today by Dr. Geraldine Luna, Medical Director at CDPH, as well as by Ken Meyer, the Commissioner at the Department of Business Affairs and Consumer Protection. We're here to do a COVID update. It's actually been a number of weeks since we've done one of these, but there are some things that are changing, and we continue to see some increases, and thought that it was important to bring everybody up to date. As always, we'll post the slides after the conversation. When we look across the world, we are seeing signs of improvement in Europe in particular. Cases have peaked there. It seems like finally we are getting through this latest version of the Omicron subvariant. We have administered almost 12 billion COVID-19 vaccines around the world, and no new safety concerns. Continues to be one of the safest vaccines available. When you look at the U.S. right now, you can see that the Midwest is lighting up a little more orange than some of the country. Some of that is because we're doing a fair bit of testing. Some of that is because we're getting through this subvariant right now. And so you can see nationally, we're averaging about 33 cases per 100,000 people every day. Both Chicago and Illinois are a little bit higher than that, at 40 to 41 cases per 100,000. But we remain out of the top 15 states in terms of cases, and I don't have major concern about the direction that cases are going. That said, if we look at community levels by county map, this gets updated every Thursday evening. And as of last Thursday, you can see that about a quarter of the counties in the U.S. were in either yellow or orange. Yellow means medium COVID-19 level, medium risk. Orange means high COVID-19 level. And so if we zoom in on Illinois there on the right, you see that northeastern Illinois, including Chicago, was all at the medium level. We are at the medium level as of today, but we are expecting that with the update, we will be moving most likely into the high level tomorrow. And I wanted to talk a little bit about that. So as a reminder, what are these COVID community levels? The CDC worked to set up a system where across the whole country, we're looking at risk the same way. When we're low, there's low community spread, limited impact on the healthcare system. Medium community spread and or some impact on the health system. And then high means high community spread and high potential for healthcare system strain. Our local risk, as I said, is medium, and you can look on our website if you want to see the details here. But the city of Chicago actually continues to do quite a bit better than the region around us. But the CDC looks at the whole health service area when they're looking at things like hospitalizations. And so, for example, with the most recent updates, city of Chicago is averaging 290 cases per 100,000 in the last 7 days. Anything over 200 is over goal. But you can see Cook County overall is at 367. If we look at hospitalizations, the reason that we're really pretty confident that Cook County, including Chicago, will move into that higher risk is because by last week, we were seeing 9.8 new admissions per 100,000. You don't need to know the exact number here, but the point is when you get to 10 as a region, you move to high. If you're seeing either 10 new cases per population or 10% of your beds being taken up with COVID patients. We're not close to either of those in Chicago specifically, but the region overall, especially McHenry County, to an extent Lake and DuPage County, are hitting some of those thresholds, and so we do expect to be moving into high. And so as of tomorrow, we'll do a formal update, but this is our expectation. What does that mean? That's what I want to spend the rest of the time talking about. Number one, wear a mask indoors in public. Yes, that means you. Regardless of your vaccination status, as we move into high, put that mask on. This is different than the city of Chicago putting an indoor mask requirement or mandate in place. We will do that if our hospitals are getting threatened. At the moment, we're at high because we've got these high case levels and we're starting to see some pressure on the hospital system, a ways away from Chicago. But even while there isn't a mandate in place, we ask everybody for this short time period while we're in high, put that mask on, especially if you're in an indoor crowded setting. Consider avoiding higher risk activities like crowded indoor gatherings. That's especially true if you have underlying conditions, you're older, you're at high risk, you're not up to date with vaccines or boosters. Limit gatherings to small numbers where you can. We know that that's not always possible, and different people will make some different decisions here. We are not putting any restrictions in place around the sizes of gathering. There are no new requirements, but these are the recommendations as we move into high. Get up to date with those COVID-19 vaccines, especially the booster, and I'm going to talk about that. Test right away if you have symptoms. If you think you have a cold, if you think you have allergies, there is a good chance right now with how much COVID is around that it could be COVID. No shame in being diagnosed with COVID, especially if you've done everything. You're up to date with your vaccines, you've been masking, you've been careful. We're seeing a lot of people get breakthrough infections because there is so much COVID around. What I don't want is people not testing because they don't want to know, they're worried about the stigma. Test. Let folks know. It helps us limit the risk and continue following isolation and quarantine. And then for people at high risk for severe disease, you may need to take some additional precautions, and there's more information about that from the CDC and on the website. Here's what our actual numbers are looking like in Chicago. So on our case counts, we are seeing some early potential good news here. We're seeing some signs of plateauing, even maybe a little bit of a slight decrease in reported cases, but our case averages are still very high, over 1,000 cases a day, and those are the ones that are reported. It doesn't even include all of the people who are testing at home. We have ways to monitor that at a population level, but we're seeing some plateauing, and that's similar to what they're seeing actually out on the East Coast. So I'm not concerned that we're on some huge increase that's going to go on and get out of control here at all. However, if you catch COVID, let me just remind you, because a lot of people have been texting me, they can't remember what to do. Regardless of your vaccination status, if you are diagnosed with COVID right now, you need to stay home for 5 days. If you're feeling better after 5 days, you can leave your house, but you need to keep masking while around others for days 6 through 10. So that has not changed. Isolation and quarantine guidance has not changed, but I just wanted to remind people. Now let's talk a little bit about hospitalizations, because this is what we're really keeping a close eye on at the health department as we move into high to sort of make these decisions. Would we need to put some additional restrictions in place? So our hospitalizations have gone up a little bit. We're averaging about 28 Chicagoans being newly hospitalized with COVID every day. However, 28 a day compares to more than 300 a day getting newly hospitalized back at the peak. So about 10% of where we were at the worst, and we're watching it closely. And this rate is increasing very, very slowly. We're seeing hospitalizations, go up about 20 a week compared to 300 to 400 a week overall on average at the peak of the Omicron surge. We're even seeing hospitalizations increase more slowly than we did with prior variants. So no major worry here at the moment, but especially as you move into high, we're keeping our eye on it. So let's talk numbers. We talk about our COVID hospital burden. How many people are hospitalized in Chicago hospitals with COVID? This is really the main thing when we think about moving beyond recommendations for individuals or encouraging settings to have masking to saying we're threatening something that is a societal good that we have to take action. There are 34 acute care hospitals, and as of right now, across all 34 of those hospitals, there are 204 patients in the hospital with COVID-19. 173 not in the ICU, 31 in the ICU, just 11 patients on ventilators. There are always some patients awaiting additional results. But you compare this to January, the peak of the surge, we had a hospital COVID burden in our Chicago hospitals 10 times approximately what we're seeing now, and a lot more severe illness. So whereas now we're under 200 patients, non-ICU, we had more than 1,600 across our 34 hospitals in January, more than 300 in the hospital, more than 170 on ventilators. So I want you to see this because, first of all, we update it every day. You should follow along. But if we start to see something that looks at all getting even toward what January looked like, remember in January, we had indoor mask requirements. We put an indoor vaccination requirement for high-risk settings in place because the hospitals were filling up with unvaccinated people. I don't at all expect on what we're seeing now that we're going to get to needing those requirements, but every day that we continue to see increases, especially in hospitalizations, the risk does get higher of us doing that. And consistently, I mean, this is amazing news. Consistently since March, Chicago has the lowest number of COVID deaths we've had since the beginning of the pandemic. We have been averaging less than 1 COVID death per day across the whole city since March. We're actually averaging just 1 to 3 deaths per week. And you think back to the beginning, 50 to 60 Chicagoans were dying every day of COVID. And so to be at a point where we're averaging, 0 to 1 is really remarkable. So let's talk boosters for a minute, because I really, really want to emphasize as we move into this higher risk state that we need Chicagoans to come up to date with boosters. Only 42% of Chicagoans who are eligible have had a booster shot. So if you got vaccinated for COVID-19 in 2021 or 2020, but you haven't gotten a booster yet, meaning you've only had 2 shots, it is time. You are technically overdue. Everyone over the age of 5 should have a vaccine booster, and that should come at least 5 months after completing the initial vaccine series. So let's talk details of this. Last week, the FDA and the CDC authorized boosters for 5 to 11-year-olds. So yes, anyone over the age of 5 should get boosted. Second boosters are available for people who are over 50 or over 12 with severe or moderate immunocompromise. But I'm especially concerned about those first boosters, and I'm going to show you some data on this. First, a quick picture. This is my niece and nephew who are in that 5 to 11-year-old group showing off their vaccine cards from having gotten their booster this last weekend. I give the same advice to my family that I give to all of you, and I very strongly encourage you to bring your kids to get up to date and then see if there's anybody else in your family or your network who hasn't had that booster. Because Omicron, and especially this version of Omicron, is really a 3-dose version of COVID, especially when we look at more severe outcomes. So why should you get your booster now? Most importantly, boosters provide significant protection against severe illness, hospitalization, and death. All of this is Chicago data. All of it is available on the website if you want to explore. But in each of these, the red line is showing you what happened with COVID hospitalizations in unvaccinated Chicagoans versus in light blue or in the middle, fully vaccinated, and then in dark blue, boosted Chicagoans. This is regardless of whether people have had COVID before. This is regardless of what treatment they've had. Purely, have people had a vaccine or not? Have they had a booster or not? So you can see at the peak of our last surge, people were 30 times as likely to die, for example, of COVID-19 in Chicago if they were unvaccinated versus being boosted. This was hospitalizations, this is deaths, but the pattern is the same. I often hear people say, I think boosters are only for older people. And boosters are especially important for older people. But let me just show you why that's actually not true. If we look at 12 to 17-year-old Chicagoans who are getting hospitalized with COVID, we see that same pattern. More likely to be hospitalized in that solid top line, unvaccinated versus vaccinated and boosted. 18 to 29-year-olds, even stronger. The folks getting hospitalized, for the most part, even now, are people who are unvaccinated, but those who are boosted have even more protection compared to vaccinated. 30 to 49-year-olds, that difference just keeps growing. 50 to 64-year-olds, we've got hospitalizations on the left, deaths on the right. Even now, we have unvaccinated Chicagoans, but also I want to point out the difference between being vaccinated and boosted. 65 to 79-year-old Chicagoans, you see that same pattern. And then finally, 80-plus-year-old Chicagoans. And the older folks are, the more important that booster is for keeping you out of the hospital, but it makes a difference at every age, and it's why we need everybody, if you're worried, get a booster. These are my other two nephews. So every single niece and nephew I have 5 to 11 is getting their booster. That's my sister, who is a Chicago area pediatrician, giving it to them. So again, time for your booster. You can get vaccinated at home. The city of Chicago has continued to put a lot of resources into our at-home vaccination program. You can get a first booster. You can get a second booster. We'll come and vaccinate or boost the whole family, available to anybody age 5 and up, Pfizer doses. And we've got appointments on weekends. We've got appointments in the evening. Give us a call. For people still getting their first doses of vaccine, there are still $50 gift cards for some of our least vaccinated areas. So as we move into a high COVID-19 level, what is CDPH doing besides vaccination? First, we're thinking a lot about public notification and information. Every case that gets reported to CDPH gets an automated outreach. You get a text message, you get a robocall, there's links to information and resources. Also, we continue to call an individual, not a robocall, anybody where we get a case reported to us age 65 or older. We want them to get a personal call, mostly because we want to make sure they're connected to care and they're aware of early treatment options. We also are still doing a lot of outbound calling, where we've got higher risk Chicagoans, who may not be up to date, et cetera. And we continue to staff our resource line 7 days a week, 312-746-4835. You need help finding a test. You need help what to do around treatment. You have questions about quarantine, whatever it is, call us 7 days a week. On intervention, we're very focused on outbreak investigation and response. So my team, I've got groups that work in various high risk settings. We focus a lot on testing and rapid case investigation, especially in congregate settings. That's long-term care facilities, group homes, jails, homeless shelters, et cetera. We're also distributing rapid tests where we need to in areas of community lead, a lot of educating providers on treatment availability. And then we're doing a lot more with monitoring and data reporting. We're increasing, as we move to high, even more sample collection across Chicago, looking for variants. We've increasing wastewater surveillance, and we are committed to doing daily updates of our data. Actually, the hospital data you can find publicly 7 days a week on our dashboard. Here is what is happening with variants in Chicago and across the Midwest. Everything is still Omicron, but we're seeing 3 different subtypes of Omicron. So that Omicron BA2.12.1, that orange on the graph there, is the most contagious version of Omicron we've seen yet. This is part of why a lot of people you probably know have or have recently had COVID. And it's part of why we're asking folks as we move into high to be even more careful in the short term with masking. So if you're worried about COVID, here are 4 things you can do today. Number 1, order your free COVID-19 rapid home tests from the federal government. You can now get 16 in total per address, 4 and 4 and now 8, and then use them. If you've got symptoms, if you've got exposures, go to covidtest.gov. They won't ask you about your insurance. There's no cost for it. They'll come free through the post office. Number 2, get your booster now and ask a friend or family member if they've gotten theirs. Nearly 6 in 10 Chicagoans have not. And to be up to date, remember, everybody over the age of 5 should have had 3 COVID vaccines by now, and those over 50 ideally should have had 4. Put a mask, and a K95 is the best protection, in your bag, so you have it readily available for indoor wear. And remember, you can spread COVID for 2 days before symptoms start. That's what's been so challenging about this from the beginning. So especially while Chicago's risk is high, universal indoor masking helps protect your fellow Chicagoans. And then finally, if you're at higher risk for severe outcomes or you're worried about COVID, please talk to your doctor and make a treatment plan now in case you get COVID. You can ask, does your doctor prescribe Paxlovid? That's the oral medication that shows an 80% decrease in helping keep you out of the hospital if you're higher risk. Would your doctor actually recommend for you one of these treatments, either oral or IV? Does your regular pharmacy stock this? I know there are folks who are worried, and I think one really concrete thing is to say, all right, if I get COVID, what should I do then? And make sure we've got a plan. And then finally, if you're worried about COVID, I do want you to remember that this is not 2020. There is no need to stock up on toilet paper. As long as vaccines and treatments continue to work as well as they are now, we are not headed back toward lockdowns. I want you to hear that very clearly. A new variant comes, something unexpected happens, the vaccines aren't working, all bets could be off there. But based on everything we have right now, we have the tools we need. We just have to make sure people are taking advantage of them. Number two, there is no need to be avoiding all human action, all human interaction. We're thinking a lot about mental health and support. Move outside, that's a good way to decrease risk. Talk to your doctor, certainly if you're immunocompromised. But given this combination of vaccines and early treatments, we want to think about your mental health as well. Please do not try to, quote, get COVID to get it over with. We are hearing people trying to do that. This does nothing to help us get over COVID as a city. It also is potentially dangerous, given that we don't always know who is likely to have more severe outcomes, and there are people who get long COVID. Don't think that getting COVID means you'll never get COVID again. We see plenty of people get reinfected with COVID. The vaccine is the most important thing for protection. And then finally, know that the city of Chicago continues to monitor this closely. We're taking it very seriously. If COVID threatens our local hospitals and healthcare capacity, we will take further action, like citywide indoor mask mandates or even more stringent if that's required. But we don't need it yet, and we don't want to get there. So everyone taking some extra precautions, especially for these next few weeks, where hopefully we'll crest and be able to come back down while we're in high, that will help protect our hospitals, prevent unnecessary illness, and save lives. So we talk a lot now about protecting hospitals, protecting Chicagoans as belt and suspenders. You don't want your pants to fall down, you put a belt on. The belt for us is vaccines. Get those vaccines, including the booster. And then the suspenders are if you get COVID and you're high risk for a severe outcome. Whether or not you're vaccinated, there are now available, effective early treatments that can help keep you out of the hospital that are authorized for anybody over the age of 12 who's high risk, but you need to reach out to a healthcare provider early if you get infected to have that discussion. You need a vaccine or a booster, you have questions, give us a call, always 312-746-4835, or visit the website. And with that, I will invite Commissioner Meyer up from Business Affairs and Consumer Protection.
Thank you, Dr. Arwady. It's always very informative. I appreciate that. Good morning. My name is Ken Meyer, and I'm the Commissioner for the Chicago Department of Business Affairs and Consumer Protection. I'm here to echo the words of Dr. Arwady and remind our business community to stay diligent regarding public health guidance. As we approach the summer and the long holiday weekend, Memorial Day weekend this weekend, it's important for our city to safely welcome visitors and to reassure them, as well as our residents, that we are taking public health measures. At this time, as the doctor just reiterated, we are not reinstating the mask or vaccine requirement mandates because the health system in Chicago remains stable. However, as cases do remain high, I, too, strongly encourage residents and visitors to wear masks. I ask for Chicagoans to please be kind and considerate to your fellow Chicagoans and visitors if they choose to wear a face mask. Dr. Arwady mentioned, and I also encourage everyone to get vaccinated and get their booster shots as soon as possible. Vaccines and boosters will help to ensure that the businesses can remain open safely. I know our business community is dedicated to prioritizing health for their workers and especially also for their patrons. Businesses seeking more information should visit chicago.gov/COVID, where mask signage is available to download. Mask signage remains optional, but is strongly encouraged. Also, BACP and CDPH, Business Affairs, Consumer Protection, and Public Health today will be hosting a COVID-19 updates webinar today at 2 p.m. And I encourage you to visit and register at chicago.gov/business education. And I'll repeat that. It's chicago.gov/business education. And that webinar will be today at 2 p.m. Again, I want to thank Chicago's businesses for protecting their patrons and employees to keep our Chicagoans safe. And now I'll pass the podium on to Dr. Luna. Thank you.
Good afternoon. I'm Dr. Geraldine Luna from the Chicago Department of Public Health, and this part will be Spanish remarks. Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy le quiero dar las actualizaciones. Si bien los resultados graves de COVID-19, como hospitalizaciones y muertes, continúan en los niveles mínimos en toda la historia de la pandemia, es probable que el condado de Cook, que incluye a Chicago, pase al índice alto del nivel comunitario de COVID-19 tan pronto como mañana, según la definición del Centro de Control y Prevención de Enfermedades, o CDC. Sin embargo, incluso si esto sucede a nivel regional, la ciudad de Chicago no restablecerá de inmediato el mandato de uso de mascarillas en interiores porque el impacto por hospitalizaciones de COVID-19 en Chicago sigue siendo relativamente bajo. Recuerden que las nuevas métricas del CDC ahora reflejan los datos de hospitalización del condado de Cook a nivel regional por el área de servicio de salud definida por el gobierno federal, que incluyen los condados de Cook, DuPage, Lake y McHenry. Los recuentos de los casos son altos en Chicago, como lo son en todas las otras partes del país. Pero los entornos hospitalarios y de atención médica de nuestra ciudad están lejos de ser abrumados. Y esto es una noticia muy excitante dentro de todos los protocolos de cuidado que debemos tener. En gran parte porque muchos residentes están vacunados y hay tratamientos tempranos disponibles para el COVID-19. Sin embargo, seguimos preocupados ya que nuestra región está cerca de alcanzar ese nivel alto. Insto a las personas que no están vacunadas o reforzadas que ahora es el momento de hacerlo. El CDC ahora dice que las siguientes personas deben recibir un segundo refuerzo de la tecnología del ARN mensajero 4 meses después de su primera dosis de refuerzo. Y estamos hablando de personas de 12 años o más que tengan moderada o severa o que estén severamente inmunocomprometidos o personas mayores de 50 años. La semana pasada el CDC amplió la elegibilidad del refuerzo de las vacunas contra el COVID-19 a niños de 5 a 11 años. Esto significa que todas las personas de 5 años o más deben recibir un refuerzo de la vacuna al menos 5 meses después de haber completado su serie inicial. Las personas de 5 a 17 años deben recibir el refuerzo de Pfizer. El CDC expresó también una preferencia a refuerzos con Pfizer y Moderna a Johnson & Johnson para las personas de 18 años o más. Si bien actualmente no hay mandato que exija mascarillas en los interiores de la ciudad de Chicago, el Departamento de Salud recomienda enfáticamente que las personas usen una máscara en lugares públicos cerrados y que continúen con otras estrategias de mitigación del COVID-19, como es asegurarse que todos estemos al día en las vacunas y los refuerzos. Hágase la prueba de COVID-19 si experimenta síntomas similares a la gripe. Continúe con las pautas de cuarentena y aislamiento y, por favor, quédese en casa si tiene síntomas o está enfermo. A medida que el clima continúa calentándose, el Departamento de Salud Pública también aconseja a los residentes de Chicago que se reúnan al aire libre para disminuir el riesgo de la transmisión del COVID-19. También los habitantes de Chicago con afecciones subyacentes que tengan 65 años o más deben buscar tratamientos tempranos, planificar cómo recibir las terapias de COVID-19 con su médico primario o su casa hogar médica para disminuir el riesgo de hospitalización si llegara a necesitarse o llegar el momento. Para obtener más información, recuerde siempre visite chai.gov/COVID-Vax o llame al 312-746-4835 y alguien le contestará en el idioma y la cultura que usted y yo entendemos. Gracias y cuídate, Chicago. So now I give back the podium to Dr. Arwady and the Commissioner.
All right, we'll take some questions.
Thank you.
I have a mic here if anybody has questions. Yeah,
¿En Spanish?
yes, sure, in Spanish. If you can just identify yourself.
Yeah. Ivonne mi nombre es Ivonne Espitia, from Telemundo. Doctora Geraldine, ¿podemos dar recomendaciones para este fin de semana feriado donde se espera casi 1.4 millones de visitantes?
Claro que sí. Gracias, Ivonne, por la pregunta. Y aquí tengo a la doctora Arwady. Ella también entiende el español. Así que sí, estamos en una posición que queremos tener la ciudad abierta, pero con las recomendaciones preventivas de salud vigente. Acuérdense, como dijo el comisionado de negocios, ser cortés. Siempre usa la mascarilla en lugares congregados, especialmente si se están congregando en lugares interiores encerrados. Pónganse al día en las vacunas, pónganse al día en los refuerzos. Anything else, Dr. Arwady, that you want to add? Entonces también recuerden, si están enfermos, por favor quédense en su casa. Y si no tienen pruebas de COVID-19, el gobierno federal ahora las está dando gratuitas. Tenemos toda esa información para que tengan acceso rápido, inmediato, a hacerse pruebas de COVID-19.
Yeah, and I would just, talking about heading into the weekend and there being visitors in town and sort of what do we need to do specifically. So a couple recommendations I would have. One is one of the easiest things that we can do to limit the risk of COVID is be outside. So if you're able to move a celebration outside, for me, that takes my concern way down. And I know as folks are gathering for Memorial Day, if you can do that, especially if there's somebody who's higher risk, strongly do recommend that. It is fine to be out and about. We just want people to be careful and cautious. I'll tell you, personally in the last week, I've been to the theater twice. It's been, everybody's wearing masks at the theater. I've been out to dinner. I did sit outside, but it is absolutely okay. I am, though, more cautious if I'm going to be seeing someone who's older or who's at higher risk. I'm using some of those home tests myself, just while I know that there is high risk. And certainly if somebody is visiting, we do see people, travel is a risk factor. I would just encourage, if you've got folks coming into town and you're worried about it, use some of those home tests. You take a test that day. If everybody's negative, the chance that you're going to have a major COVID outbreak or super spreader event is quite low. So it's thinking about the risk of who's there, what's available. But the nice thing during the summer is that we can be outside as much as possible, and I encourage you to do that.
Any follow-ups? Were you good? Any other questions? Yeah.
Good morning. For Dr. Arwady. We're hearing a lot of reports of at-home tests showing repeated negative results, but PCR tests come back positive. How accurate are these at-home tests? Should people get a PCR instead? And could this have something to do with the new variant being more evasive for the at-home test? Is one more effective than the other?
Those are good questions. So, couple things. First of all, especially when we're at medium or high and there is a lot of COVID around, a positive test is a positive test. I don't want people taking a home test and saying, oh, that was positive, let me go try to take, either one is positive, you treat it as a positive, and we would want you to isolate for 5 days. I will say I really like the home tests a lot because they give you the on-the-spot action, and you can, you can take action as a result of it. If your viral load is still pretty low, like let's say you've perhaps just been infected, et cetera, they are less likely. The home test may be less likely to be positive. So it doesn't mean it's not 100, if it's positive, it's positive. Like, we don't worry about false positives. But you can get a negative test and potentially still have COVID. If you have a negative home test and, your level's probably pretty low, and the chance of you spreading it is lower, but it's not zero. I tell people there's one situation where I really want them to get a PCR, go out and get a formal lab test, and that's if they're traveling internationally, because people can test positive for a long time potentially. It doesn't mean that they're still infectious or spreading COVID, but especially with the really sensitive tests, it can be positive. And we've had a few situations where somebody takes a home test, leaves the country, and then is still testing positive, can have some difficulty getting back in. As long as you've got a documented test, that's 10 days ago, that counts. And so I encourage people to go get a PCR if you've got to do international travel. Other than that, people can use whichever they're comfortable with, but I don't have a concern about this variant not being picked up on home tests in any different ways. I think where we see some variation, it's that the PCR is the most sensitive. Like even a tiny bit of virus, you'll pick it up there. Whereas in a self-collection, there's a little bit more variability in terms of how well people are collecting and exactly the time that they're collecting. So if you have had a high-risk exposure, and you're worried that you might have COVID, yes, use those home tests, but take other precautions in the meantime. But I have a lot of faith in the home tests. I use them myself. I haven't had a PCR test in months. I just use the home tests, and they've all been negative to date, but if they were positive, I would act on that.
Other questions? Yep.
Are you worried about stopping short of a mask mandate is really just going to further spread COVID? I mean, let's be honest here, human behavior works by when somebody makes them do something. I was at an event last weekend, graduation. I think less than 5% of the people were wearing masks in an indoor setting.
So we've talked a lot about this, and let me tell you how we're thinking about this. Number one is that I very strongly encourage masking at events like graduations, large events that are pulling a lot of people together. We're in strong support of any business or other setting that makes a decision to require masks during this time. Like I said, I go to the theater partly because I know that everybody is required to mask in that setting. However, when we think about using sort of legal requirements and enforcing it, to my mind, we do that when there is need to do that because you're threatening something sort of at the societal level. And so for me, if you think back to January when we did have the mask mandate and we put that vaccine requirement in place, that was about sort of protecting hospitals, because we can't be in a space where if you have a heart attack, the hospital can't take care of you. And we really were seeing that level of stress on the hospitals, in the year 2022. I want to save requirements for when we really need them. I'm not hesitant to use them if we need them, but I also am, I know that there are a lot of people who are sort of wishing that COVID is over, and it's not. And I am concerned that we could get a new variant, for example, that is really infectious, and we're seeing totally different viral dynamics starting to, and we would have to potentially do this. Nothing that I'm seeing in the current Omicron surge suggests that we're going to see anything that's out of control in terms of infections. If anything, we're already seeing some plateauing. But I think the main thing is trying to maintain trust in the public, know that when we are putting requirements in place, it's because we really need it at that time. And we're not going to eradicate COVID, and I want to make sure that mandates go in at a time that there's a major societal need for it.
I know you're a doctor, not a politician, but there are many people out there that say that mask mandates are never going to come back because this is an election year.
So I can tell you that here in Chicago, if our healthcare system is threatened, I would not hesitate to put a mask requirement back in place. This is a big conversation across the country. That may not be true in all parts of the country, but it's true here in Chicago. I really feel very strongly that if you're seeing, the last thing we want is COVID to get out of control again, right? When we're having an average of 0 deaths from COVID a day, we don't need to turn our lives upside down. We don't need to be putting, the requirements for all in place. But, I can tell you certainly from my standpoint, I would be putting extremely strong, recommendations and having those conversations. And I know, based on the decisions that we've made to date here, that if there were a need to do this, we would do some of it. We wouldn't want to do it, but we would do it.
Aaron?
I've got a lot. Hope you brought a lunch. First off, with COVID, why is there more spread right now in the Midwest and the Northeast? Is there some kind of context between regional case rates and vaccination rates compared to the South?
There's it's more about what's happening with variants, actually. So if you look nationally, the thing that's been challenging, Omicron already so much more infectious, so much more contagious, and we've seen now 2 subvariants come through and overtake even the early version of Omicron. And if you look at what's happening nationally, you sort of see these surges come as the new, more infectious variants become predominant. And so the newest, most infectious one just became predominant across the US. But if you look at the East Coast, you look at the Midwest, there's even more of that more infectious variant. The other thing, though, is, and the reason why CDC uses both case rates and hospitalization rates and how the full hospitalization is, which I think makes sense, is because case rates are highly impacted by how much testing is happening. And we know this has been formal testing, we know that there are parts of the country that are doing very little formal testing for COVID. And when you see that, you know that it's not that there isn't COVID, you're probably not just detecting it in a formal way. So the reason to pair that case count numbers with what's happening in hospitalizations is everybody gets tested across the whole country and always has around hospitalizations, and it becomes a way to sort of follow and monitor.
I'm just wondering what you think, and you may have done this because I was taking notes earlier, the role of people who've already recovered from Omicron have to play in this. I got it at the beginning of the month, and I am wearing the mask in public because I think it's important to show it for people on transit and that kind of thing too. But I'm not infectious, and I know people who've gotten it several times at this point, and the last thing they want to do is wear a mask because they're over it and they think they're immune, and they may well be immune to this kind of thing too. But there is fatigue, especially among people who had it and they've gotten all 3 shots and blah blah blah. What would you say to them, and what is the scientific reality?
Sure. So there is fatigue, and this is a little bit of where, again, when we put a requirement in, we're doing it because there's a major public health need right now to do it. What I would say about folks who have recovered from Omicron, first of all, if you recovered from COVID and it was not in the year 2022, it doesn't count. Like we are seeing very little ongoing protection from people who were infected with the original Omicron, with Alpha, Beta, Delta, et cetera. Lots of people who had prior infections are getting reinfected with Omicron. So just to be really clear about that. For people who have been infected since January or so, little bit in December, but primarily January and forward, almost certainly you had Omicron, and you are more protected than somebody who has not had Omicron, but it isn't 100%. And one of the concerns has been, as we've continued to see these subvariants of Omicron emerge, there are some that we haven't seen here, particularly BA4, BA5 in Europe, where they are starting to see a little bit more of kind of the reinfection, even from kind of an earlier version of Omicron to now. So I worry a lot less about somebody who has recently had Omicron, but remember, we've never seen protection last more than about 3 months or so, kind of after an initial infection, really. And so I really want folks, even if they have recently had Omicron, yes, one of the reasons, just to take this a little bit further, one of the reasons I think that our hospitals are doing quite well is that we were hit so hard with the initial Omicron surge, frankly, in January, December, January, and we had a lot of folks hospitalized there. We had a lot of infections at that point, and that is helping to protect and provide, some protection if people, didn't die. They are carrying some immunity from that. So at the beginning, we could very confidently, sort of back in February, we could really confidently say that 90% of the people were not getting reinfected if they had had a version of Omicron already. That's been dropping a little bit, though, around the world.
I've got several questions about meningitis and monkeypox. My understanding, I did an interview with Howard Brown's director of infectious control, and I was also listening in on the CDC's Monday press conference, is that it's a sexually transmitted disease, predominantly right now among gay and bisexual men, the lesions, instead of going up on the trunk and on the palms of the hand and that kind of thing, are now showing up on the anus, inside the anus, in the mouth and the throat, and on the genitals. Cases are increasing exponentially right now. The incubation period's 2 weeks, and there's going to be thousands of more cases identified because the incubation period is so long. I'm wondering if the city is building up public health resources and education about this outbreak, given likelihood of community spread in the city, and I'm wondering what people need to know to keep themselves safe right now.
Okay, so couple things. Thank you for raising that. I want to just make sure folks are clear on what we're talking about, because not everybody's necessarily been following. So there's been some attention on a virus that is known colloquially as Monkey Pox. It does not come from monkeys. That's just what it was initially detected in. And it's a virus that is not related to the COVID virus. It's in a completely different family. One of the reasons why there's attention to it is it's in the same family that the smallpox virus. We don't have smallpox anymore. We eradicate it, but it's in that family. And usually in a normal year, we will see a few cases, mostly in Western Africa, that are related to animals. There are animals that can carry it, and we'll see a few dozen cases that people can get infected just from being in contact with animals. The reason there's been more attention is that at this point there's been somewhere between 100 and 200 cases that have been identified that are not connected to the typical way that we see monkeypox turn up. Typically, again, we've had just for context, one prior monkeypox outbreak here in the U.S. It was here in Illinois. It was linked to prairie dogs, and there were imported animals, and there was some exposure. That was back in 2003. People got better. It's pretty uncommon, but we do see it from time to time. What we've seen, and the reason there's been just some interest, is that more than 100 cases in a number of different countries, in Europe, in the US, some in Asia as well. And it's not tied to animal exposure or to travel to West Africa. And notably, as you said, we've seen more of these cases in gay, bisexual, and men who have sex with men. But to be clear, we have also seen cases in others. So it is not just in that population. I will just show you real quick. This is what the rash can look like. It is rare. I want to emphasize that. So I would push back a little bit on we're for sure going to see thousands of cases. We don't know. The reason that we're watching it closely is because it's just showing up a little bit differently. And we want to make sure we understand it. So it's rare, but it is potentially serious. It spreads through contact with body fluids. So kissing, for example, or through contact with sores. And there is certainly some speculation that through contact with sores, people who are sexually active could be spreading it in that way. We are very closely monitoring that. There have not been cases that reported at this point in Chicago or Illinois. I wouldn't be surprised if we potentially see some. That's different than this is a major problem at this point. We have been in a lot of conversation with our providers around town, and especially providers that do primary care or work in sexually transmitted infections. We've gotten calls, which is what we want, from clinicians if they're seeing even a potential case. If you develop symptoms, especially an unusual rash, usually there's a fever too, go to your doctor. That's what we want you to do. I would hope that is what you would always do if you are developing an unusual rash. And then your doctor has the ability to take a little swab off one of the rashes, and we can test for it. We are doing additional communication. We've been in touch with lots of folks. Of course, we're heading into Pride Month of June, but I want people to hear that this is not all in the population of men who have sex with men, and we're still learning a lot about it.
I mean, the reason I'm particularly interested is that you touched upon it right now. I mean, the Associated Press reported that 4 outbreaks in Europe were traced to raves, bathhouses, and gay sex parties. We're about to have a huge event this weekend that's a conference, International Mr. Leather. Thousands of gay men are about to come to Chicago, many of whom are going to have a lot of casual sex, and then Pride Month is coming up. I mean, it's going to be going on around the country at this point too. I mean, the epidemiological circumstances seem very similar in Chicago this weekend to what's going on there overseas, and there's a number of these cases that are going on around. There's events that are happening in the country right now that are going to be happening there too. Are you worried about something happening?
So, obviously we're aware and in touch. Again, this at this point has not been a sort of explosive kind of outbreak. So we're communicating, but honestly, one of my bigger concerns is people could get mistaken for syphilis, for example. Like, there are other diseases that can present. And again, I don't want people thinking that for sure this is sexually transmitted or even entirely, in this population. So, I think if general advice is not dissimilar from what we would give otherwise, that if somebody is, I would think twice about being intimate with someone who has active and a new rash and you don't know what it is, and they should go to their doctor regardless of what it is and sort of get tested. So we're doing some additional communications, and there's quite a bit of awareness, but we're set up if and when we detect cases. There are vaccines and post-exposure prophylaxis and things that we can use should we need to.
And the only other question I had was, thank you, about the meningitis outbreak in Florida right now among gay and bisexual men. Is there any reason for men in Chicago to get vaccinated at this point? Obviously, people can take it and colonize places elsewhere.
Yeah, so I always encourage everybody to be up to date with all vaccines, including meningitis vaccines, if you're being recommended for your doctor. We have a good surveillance system in place for meningitis. We're used to responding to it, and I don't have a high level of concern at all at this point. But always, if people are reading something in the news and they're worried about it, know what the symptoms are. If you have those symptoms, please go see a doctor, go see a healthcare provider, and they can help figure out whether that's something to be concerned about or not. And if it is, we can do the testing, we can handle it.
Thank you.
There's one more.
I just have one more back to COVID.
Mm-hmm.
Is it sound? I don't even know if it's on. The booster rate has remained below 50% for
Yeah.
a long time.
Yep.
So what does this say? And is there a concern that eventually, as these vaccines start to wane, the original two, that we're going to see another surge in the fall?
So 2 things on this. One, you noticed I spent quite a lot of time talking about boosters today and sort of showing Chicago data for different age groups. I love data, so I'm someone who looks at these and it's convincing to me. But I think people, we put around the country, not just here in Chicago, a lot of emphasis, on those first and second doses. And I think it's interesting. There's some ideas out there that, and somehow a booster is really unusual or that it's unexpected, whereas many diseases have repeated vaccination requirements. You think about flu, which is of course an annual vaccine, but even tetanus is every 10 years. You think about the childhood vaccines, it takes multiple of them. So it's not a surprise to me, but I think people have felt like they haven't needed it. And at an individual level, especially if you're young, it's true that you are less likely than an older person to get a severe illness, but getting boosted, even if you're young, cuts that risk even further. And we don't see, there's really no negative or downside to it. I think one of the reasons we're really talking about it now is because we're at high risk, or we will be, or we expect to be. And so as we move into that high level, all I want is for people to not get sick with COVID, especially seriously ill with COVID. And all I want is to not have to upend our lives in any way. And a booster is a very concrete thing that helps the individual and helps Chicago. So we've been, it's one of the reasons we're lifting it up again. I think there was, frankly, a fair bit of confusion around boosters because the timing was changing, right? If you remember, it was 6 months later and 5 months and 4 months and 2 months, which is why I tried to simplify it today, that unless you started getting vaccinated in 2022, you're due for a third dose. And look at your card. If you haven't had a third dose, you're 5 or over, you should have had it. And so I think there was also just some little bit of confusion there. There's been the second booster conversation, and I really wanted to make it clear that this is one of the main things that you can do. Related to what's coming, I don't know for sure what's coming. We've not seen what we've seen in Omicron before, these like sub-variants of the same dominant strain continuing to emerge? Will we see another sub-variant of that emerge, or will we see something completely unrelated, or very unrelated, which is what we've often seen before? I expect come fall, assuming that COVID is still causing significant morbidity and mortality, I assume that we will probably see a version of a COVID vaccine that has been updated to be more specific to fight against, Alpha and Delta and Omicron and all the changes that the virus has had. I don't know for sure that that will be the case, but that's my expectation. And so I don't want people, I've also heard people say, I don't want to get a booster because I'm waiting. I want to try to time it for when I have vacation, or I want to wait until the fall and get it then. Please just get it now. Now is when it's high. Now is the time that it's most important for yourself. And I think in the fall, probably there will be a version anyway that will be slightly different. Might we end up with sort of an annual? Like for flu, it's possible. But where I look ahead through this summer, I want us to have a good summer. Getting boosted now is the best way to do that.
Great. Thanks, everybody.
Thank you.